Which hormone is responsible for decreasing the urine output? And what this is referring to is that there's a hormone. It's located in the hypothalamus, and it is in the brain. And the brain has a connection with the hormone usage to the urinary system here, which over here we see the kidneys, which has the ureters, the bladder, the urethra. And we want to know which hormone controls that conversation between the brain and the urinary system to know should the amount of urine go up or should it go down. So an important word to remember when you're thinking about how the urinary system works is think of diuresis or diuretic also. Diuresis, diuretic. So you may have heard of the term diuretic. You might have heard someone saying that they're on a diuretic medication. What does that mean? So that has to do with the loss of fluids. So if someone has a diuretic, they're losing a lot of fluids, all of the urine's being made and it's being expelled from the body and they're losing a lot of fluids. So when we think diuresis, think loss of fluids. So decreased fluids. Or you could also think of it as an increased urine output. So when you hear the word anti-diuretic, you have to reverse it in your head because it'll be the opposite. If someone's on an anti-diuretic, then you're going to have the reverse effect. That means that there will be more fluid retained, so more fluid inside. Or you could think of it as a decrease in urine output. So they're not going to be urinating as much as if they're on a diuretic and it's all coming out. And they might be on that medication, if we're talking about in terms of diuretic medications, for a variety of reasons. It could be used for blood pressure to reduce the amounts of fluid. But that's a side conversation right now. We're just focusing on urine output. Is it increasing? Is it decreasing? Do we have diuresis or do we not? So if right now we are focusing on decreasing the urine output, meaning that we want decrease of urine out and then more fluid inside, this is what we're focusing on. So if we look at this part, the anti-diuretic, we have more fluid inside and we have less urine being put out, decreased urine output. So this would be related to the anti-diuretic hormone. And the anti-diuretic hormone is another term for vasopressin, which we could see is listed here as option D. So we could go with that. Options A, B, and C, just going over what those hormones are. Option A is cortisol, which is kind of like your stress hormone, and it's produced by the adrenal cortex. So it has a very inflammatory type of process. So it could also be used for boosting blood glucose levels. Cortisol would be raising kind of like the stress hormone. So if someone has a lot of cortisol, there's a lot of stress within the body, the glucose levels for that person can increase. So again, not what we're looking for. We're focusing on this decrease in urine output, so we could eliminate option A. Option B, we could eliminate as well. This is produced in the pancreas, the glucagon, and this has to do with increasing glucose levels, which is not what we're focusing on. We're focusing on the decrease in urine output, different hormone, so we can eliminate option B. And then option C, this is produced in the posterior pituitary, and it has to do with the muscular contractions of the uterus during childbirth. So not related to this decrease in urine output that we're looking for, so we can eliminate option C. So option D, vasopressin, another word for an anti-diuretic hormone. This is what we are looking for.